can't treat dead people.
It isn't going to help those who are struggling with this drug.
Nearly every day, someone in King County dies from an opioid overdose. Often, heroin or a prescription painkiller is to blame. To fight this epidemic, the city of Seattle plans to open the country's first safe consumption site, where drug addicts can shoot up under medical supervision.
People are going to use whether we intervene or not.
A legal drug injection site in Vancouver, BC, is our closest model for how the new system would work. But opponents in King County say it's not the answer.
I think that the results that come from it are very concerning.
Are safe injection sites a public health solution or a public hazard? Our studio panel weighs in.
We could become overwhelmed. We're really excited.
A controversial solution to the growing opioid crisis. Next on City Inside Out. Welcome to City Inside Out. I'm your host, Brian Callanan. Every 24 hours, about 2 people in our state overdose on opioids like heroin or prescription pain medication and die. It's a national epidemic that has some of our local leaders considering controversial options like safe consumption sites. These sites, now in 9 countries outside the U.S., allow people to use illegal drugs under medical supervision, which supporters say saves lives. But opponents are pushing back with a major legal challenge, claiming safe consumption sites would actually create a serious public safety hazard.
Heartbreaking. Heartbreaking.
The first time she even used it was 4 months before she died. 4 months.
Corey Durant and Michael Roberts have something terrible in common. They've both lost a loved one to heroin.
I actually planned on taking her to detox and treatment the day she died.
He was a good kid, and losing him, it's been tough.
But these two are very different when it comes to a newly proposed response to the opioid epidemic in Seattle and King County, so-called safe consumption sites.
He was the first one to say he would have abused that.
Corey's brother Eric died in March from kidney failure after using heroin for 26 years. She says he was against the idea of consumption sites, places for drug users to inject heroin under medical supervision as a way to prevent overdose deaths.
And he goes, "This isn't going to help us."
Safe injection sites can be found in 66 cities worldwide and have been endorsed by the American Medical Association. But Corey says the concept is misguided.
We need treatment on demand, we need mental health, we need housing, vocational training. We need to do more to promote not using rather than using.
Why I support it is because you can't treat dead people.
Michael Roberts' only daughter, Amber, was 19 when she OD'd on heroin and died in this very bedroom.
This is right here.
Roberts started Amber's Hope, a nonprofit dedicated to opiate prevention and education after his daughter passed away.
Safe consumption sites save lives.
He isn't sure if a safe consumption site would have saved Amber, but says it could have been an option for a young woman who felt like she didn't have any.
Not only does it prevent the overdose, but it builds that trusted connection, so when you're ready to ask for help, you can, and it will be provided or show you how to.
To confront this epidemic, we need a comprehensive regional approach.
A King County opioid task force proposed opening 2 safe consumption sites last year, setting off a firestorm of debate.
75% of people support our position, saying we don't want heroin injection sites.
Josh Freed sponsored I-27 for the ballot to ban public funding from being used for safe consumption facilities in King County. Yet before it was put to a vote, I-27 was struck down by a King County judge as an infringement on the work of public health officials. But Freed has appealed that decision to the state Supreme Court, as he hopes to let voters have a say.
The earliest probably at this point would be an April election, or maybe pushed off until August or November.
Freed is critical of safe consumption sites like Insight in Vancouver, BC, touted by Seattle leaders for preventing more than 5,000 overdose deaths since 2003. But Freed, who's visited Insight several times, says it only helps 3% of its clients get into treatment.
As a society, we're equipping people to continue to use and enable them and continue to use and use of heroin, which is killing them. That's not compassion. Compassion is, let's turn people to health and get them help today.
Yet while the consumption site courtroom battle plays out, drug abuse on our streets continues to rise. King County saw a record high 332 overdose deaths last year, 2/3 of those coming from opioids. And simply adding more treatment is not the answer, says Michael Kowalczyk.
Nobody just can stop using tomorrow because they want to. It's a disease.
Michael works with local law enforcement to see if she can connect illegal drug users to intervention programs instead of jail.
Anybody I need to talk to today?
It's called a harm reduction model, meeting people where they are and not stigmatizing their drug use, but offering some help.
Have you ever gone to public health? Okay, do you know where it is?
It's a challenging, sometimes frustrating task. But studies show diversion programs like these are reducing criminal behavior. And Michael believes safe consumption sites could help even more.
So people are going to use whether we intervene or not. So why not give them the opportunity to connect to services? They're just people who should be treated with respect.
I think we're ready to vote.
The Seattle City Council has put $1.3 million towards the building of a safe consumption site in its 2018 budget, which supporters see as a good step. But is it a step in the right direction? Even the families of heroin victims disagree as they wrestle with the memories of their loved ones and the future of drug treatment policy in King County.
The bottom line right now is it saves lives.
I love my brother dearly, but as a taxpayer, I'm appalled.
And joining us to discuss this very important topic a little bit further, we have with us Seattle City Council member Rob Johnson. Rob, good to see you again.
Hi, Brian.
We also have with us Chloe Gale. She is co-director of REACH, a social services group. We'll hear a little bit more about that in just a minute. Chloe, good to have you.
Thank you.
We have with us also Gretchen Taylor with the Neighborhood Safety Alliance of Seattle. Gretchen, good to have you again as well. And finally, Dr. Joe Merrill. He's at Harbor View Medical Center, practices there, also an associate professor of medicine at the UW. Great to have you, Joe. I want to start broadly with this idea of safe consumption sites, if I can, also called safe injection sites. What is your opinion of these facilities? How do you think they could impact King County's opioid crisis? Rob?
Thank you for starting this conversation, Brian. You know, as I have been out in community and talking with folks, it is a scary situation, the number of folks that are using heroin in our streets. And what we see throughout the city is a number of places that are what I would call unsafe consumption sites, whether they're public restrooms, whether they are restaurants, whether it's in our parks or just on our streets. And I think that the idea here for us is to try to offer a place where people can get connected to services so that if they're showing up for the first time, for the 10th time, or for the 100th time, if that's the day that they decide they want to get clean, they can get access to someone that they have built a relationship with that can help get them off drugs.
Thank you very much for that. Chloe, same question to you. And if you could, tell us a little bit more about REACH as you're answering this. How REACH is connected to the opioid crisis maybe, and how you think safe consumption sites could impact the work that you do.
The REACH program has been around for 20 years. We're part of Evergreen Treatment Services, and Evergreen is a medication-assisted treatment facility, so they do all kinds of treatment for people with opioid use disorder, including methadone and Suboxone medication. Yeah. The REACH program has been doing street outreach and particularly trying to work with people that are unsheltered and use drugs and alcohol. So that's what we've been doing for 20 years. And we're really excited to see this opportunity actually in our community. We work with people who probably face the biggest challenges in terms of their use every day and trying to get change and get into treatment. And we really feel like this has been a missing link on the continuum of services, so that the people who really are not ready, cannot get in today, this is the opportunity we have to keep them alive, connect with them on the street.
Thank you very much for that. Gretchen, to you next. Tell us a little bit about the Neighborhood Safety Alliance, the work you've been doing on this, and also what effect that you think safe consumption sites could have on our opioid crisis.
Thanks. The Neighborhood Safety Alliance of Seattle is a group of volunteers, and our mission is to ensure that Seattle remains one of the safest, healthiest places to live for everyone, whether they're housed, unhoused, whatever community. And our concern is, well, it's huge. We're concerned because we're thinking that the task force recommendations, we really promote that, trying that first without the injection site. We believe that the infrastructure for the initiation of an injection site is not in place, and we could become overwhelmed and in as much chaos as they are in Vancouver because of that very thing. The infrastructure has completely been overwhelmed.
Okay, thanks. We'll dive into some of these issues in a bit. Appreciate that. Dr. Merrill, I want to have you tell us about your research on consumption sites, the work you do with heroin users, opiate users here. How could having a safe consumption site impact Seattle-King County, do you think?
Well, I'm an internal medicine doctor and addiction medicine doctor, so I take care of folks who are seeking treatment in the primary care setting, also in addiction treatment setting at Harborview. And I'm in support of the safe injection sites, primarily as a way for patients to access treatment. I know that patients, when they come into treatment, they're facing many obstacles, and it can often take quite a while, even after people have presented for treatment, to get better. So, and that getting better may mean that they get housing before they stop using, or get their mental health care before they stop using. And I think that a safe injection site can provide an opportunity for people to get better in ways maybe before they even stop using substances, and give them an opportunity to connect with people, make a relationship, and get better. And when they're ready to stop or able to stop, they can access treatment.
A very complex issue that goes beyond drug use, that's for sure. Rob, I want to jump into this. I think I've heard this from a few different people that I've just kind of talked to, friends of mine. Safe consumption sites are a hard concept for a lot of people to wrap their heads around here, taxpayers especially. You want to invest more than $1 million in a place where people can come in, use some illegal drugs, and leave no questions asked. So the pushback that I've heard is, even from a heroin victim's family, is this: you're not treating the problem. Where's the accountability here?
I think the accountability lies with the fact that we are spending a lot of money to bring services to folks who are using on the street every day, and we're losing folks. I mean, we have overdoses in this city, and Chloe knows the statistics, I'm sure, better than I do, but it's very regularly, if not every day. What the benefit of a safe consumption site would be allowing for someone who is currently using to be able to come to a single point of contact where we have not just a place for them to use, but also attendant services too. And that is going to both save lives, because we've seen time and time again that the safe consumption sites excuse me, around the world are preventing overdose deaths. And then secondly, it's going to allow us to have a consolidated treatment like what I think Gretchen and many other folks have been advocating for, which is how do we provide attendant services in a way that really can meet people where they are.
Do you worry about that infrastructure piece that Gretchen brought up there, that this would attract a lot of people to an area? It'd be the first one in the country if we set one up here.
What I am concerned about is making sure that we have enough infrastructure to be able to provide those wraparound services. And our hope is that the almost $1.5 million that we put into this will be enough resources to help renovate an existing facility to allow for us to have not only the booths where people can consume, but also to have the back end support with both nursing, mental health, and other counseling services.
Okay. Chloe, I want to try to take this a different path with you, because I know you work in a very data-driven business here. Social service groups like yours want to get funding, they have to show results. So I look at a place like a safe consumption site inside Vancouver. Only 3% of its clients are getting into rehabilitation there. Does investing in a model like that make sense if that's the success rate?
Oh, I absolutely believe it does. And part of it that's critical is this is not just a standalone project. This is a whole range, it's one piece of a whole system of care. And really the heroin task force, which we participated on, a whole group of providers around our community, really identified this as one piece, one missing link in terms of our whole system of care. So I actually think that we don't know when people access treatment. Maybe they didn't access treatment that day, but maybe a week later they decided that that was the moment to go make a change. For me, I think often what causes people to change and really want to turn around their lives is not necessarily additional stigma and shame, but in fact hope and a sense of opportunity for change.
Okay.
And that's what this space would bring, and I think it will absolutely turn people around.
Gretchen, let me try this another way with you too. So last year, 332 drug deaths in King County, a number that's up 44% since 2011. 2/3 of these cases, opioids. We heard it from one of the victim's fathers, the victim's father in the setup piece. You can't treat dead people. So the argument is, let's try to make at least some connection with drug users instead of letting them die.
Oh boy, this is really a tough subject. I'm a mother of a heroin addict, adult, and he's been an active user forever and ever, and I asked him that question. I said, what do you think about injection sites? And he said, well, that's really a mixed bag, as we all know, sitting at this table. But he said, I'd have to come down and say no, because he said, why would you continue to perpetuate the very thing that's killing me? So why would you make it, I'm safe when I go in there in the sense of if I overdose, and I might, that I'll be brought back, and that's to be expected. But if Insight, and I know that King County and Seattle councils are trying to distance themselves from the numbers that are coming out of Vancouver. I know that. But the thing is that if you have, well, 6% of the people who are clients at Insight being referred to further services at Onsite, and out of that, less than 1% complete.
Right.
How does that, what's the end game there as far as saving that life, you know, for long term? In the moment, yes, but long term, what is it?
Maybe I can get a medical perspective on this, doctor, and bring you in here. So I'll try to work through this scenario, and I think this might happen to you. You're up at Harborview, you're dealing with a patient with an infection of some sort, and it's very clear that this person is a heroin user. So the patient is leaving the hospital. What do you want to see happen next?
Well, what I want to see happen next is that the patient has the opportunity to get into treatment directly from the hospital. And we are working towards that with funding that is new funding coming from the federal government to the state. And there's a number of networks being generated across Western Washington to provide improved access for Suboxone or buprenorphine treatment. We also at Harborview have a system where folks who are seeking treatment and admitted for a medical reason can access methadone treatment as well. Not everyone chooses it. Not everyone who has an infection is seeking treatment. Sometimes they change their mind during the course of an admission, but we're trying to be there for them so that if they are ready, that they can access that treatment.
Would you want to let them know where a safe consumption site was, I guess, when they were leaving? Or?
Well, we do talk to people about keeping needles clean and how to inject, and so that they don't get HIV or hepatitis C from their drug use. And similarly, I would be supportive of a place where they could go and be safer, even if everyone agrees they're not safe.
I hear what you're saying. It's just one of those things where, as a doctor who wants to make people healthy, I just look at that and I think when this person's leaving, you want them to go into treatment. It must be very difficult for you to say, well, here's where the clean needles are. I hope you see where I'm going with this.
Yeah, well, I mean, I think that there's a lot of things that can happen before people go to treatment. And if they can have a medical interaction where they're not feeling stigmatized, where they're feeling like they're being heard, maybe that's the first time they've had that kind of interaction. So that's something to build on. And it may be that the treatment isn't the first thing they want. Maybe it's housing that they need. And it may be really a challenge to get treatment without housing. So again, part of the overall set of services we need includes housing, and a big problem in Seattle.
All right, thank you for touching on that. Rob, I want to go back to you here. Many cities that used to be on board with this idea, Auburn, Kent, are now saying no to this. Almost a dozen cities around our area, Snohomish County too, are saying we want to ban safe consumption sites. The I-27 group, we heard from them in our setup piece there, they're saying 75% of the people in King County do not want these. What does that say to you that all these communities are rejecting this? And Seattle, at least for now, is going this alone, it seems like.
You know, I haven't seen the polling or the data, so I can't speak to those numbers. But what I can say is that, you know, from a public health model perspective, I'm a big believer that there are sea changes that happen over a long period of time. You know, look how long it took for us to convince folks that smoking was an unsafe thing. And that was a decades-long process, and we're still waging war against tobacco companies. This is an opportunity for us to continue to educate people about the dangers of the addiction that they have, while also providing for them a place where they can get, as Dr. Merrill said so well, unstigmatized medical advice. That unstigmatized medical advice will keep people alive. And that is, I think, of paramount duty for me as an elected official. Part of my job is to try to keep people alive. And if we can keep people alive, we have 100% higher likelihood of getting them into treatment.
Sure. I guess it wouldn't be a situation if Seattle had a public vote on safe consumption sites. Would it pass, or that you're even thinking about that?
I don't know, but what I do know is that, you know, I'm out at the farmers market in the University District just about every Saturday, either me or my staff. And we hear from folks all the time about the number of needles that they're finding in parks, in restaurants, in bathrooms, on the sidewalks throughout the city. Finding a place where those folks who are using outside in our public spaces right now can go and be safe and get access to treatment has got to be better than the alternative that we've got right now.
All right. Chloe, I want to go on this path a little bit further. So the Insight facility in Vancouver, a lot of critics say you got drug deals going on right outside the door. If such a facility were put in place in Seattle, would you be concerned that it would create a public safety problem in the name of public health?
I'm not really concerned about that. I think that you're speaking about one isolated facility. There are dozens of facilities around the world, and they're really designed differently. We've a close colleague of mine who works in this field actually stayed in Amsterdam, 1 block from a safe consumption site for a week. He had no idea that it was there. It was literally just a corner shop, same as anywhere else in the neighborhood. And he's a trained professional. So I think that we don't know exactly what it's going to look like. I also know that it's only going to be effective if it's going to a location where people are already using. That is where we would want to do it. And exactly as Councilmember Johnson just mentioned, that we have communities already where we know that people are using. There are already needles. I go every day in Belltown into my alley and I often see people who are using in the alley, and I'm filled with fear for them. I would rather have them be using inside in a safer space.
Gretchen, I'm going to come to you, because what I hear here feels almost like a cultural change of sorts. And I hear this phrase, stigma. The word stigma just comes up over and over again. Addicts already feel like outcasts from society. And so I think a lot of advocates would say, with this argument over safe injection sites, they're dangerous, we don't want them, only serves to stigmatize these addicts even further. What do you think?
You know, oh golly, there are 23,000 estimated heroin substance abusers in King County. So my question is, I'm going to skirt just a little bit before I get to that, but I'm curious to know how a site, say in Capitol Hill or downtown somewhere where they're already using, is going to draw people who are abusing from Renton, from other parts. How do you draw 23,000 people when they won't go more than about 5 blocks?
Rob, can you answer that piece of it? Is that a part of the consideration here?
Yeah, I mean, I think to Chloe's point from earlier, I think the intention here is to make sure that we're setting up a site in a location that is feasible and where we know that folks are using on a regular basis. And frankly, that's a lot of places throughout the city and throughout the county. But we've got a study that we're asking the city and the county to do together on feasibility of locations, and more work to come on what a setup and an actual location.
I wanted to make sure I answered that for you, Gretchen, please.
Because I hear what you're saying, and in looking at Insight, because my gosh, it's 2.5 hours away, that's exactly how they built the program there. They built it on 4 pillars. They were where the injecting was already going on. Look what's happened to that area. It's desecrated. In fact, it has 6% of the population, and it's got 70% of the crime that goes on within a 10-block radius of that area. And there's an injection site there, and they pick up 5,000 needles a month. So, I mean, that's just in this area.
Yeah.
So,
Chloe, could you touch on that real quick, and then Doctor, I'll go to you, please.
Yeah, I just want to respond
because you've been up there a few times.
I visited Inside actually just this time last year, and I will say that there were a lot of issues in that neighborhood long before Inside entered in. In fact, I believe it's been the highest concentration of substance use in North America for decades. So this was an issue that happened prior to Insight. I will also say directly across the street is a brand new condo. Brand new, wealthy people are moving in. So I don't think that the fact that that one facility is located in that neighborhood is all the fault of that facility. It really is a much bigger issue.
I'm just saying that it's written up in tourist manuals now. Avoid. Do not get out of your car. If you are there, don't roll down your windows. Now, I ask you, I can have a big condo here, but how does that impact the economy of that area when it is such an off-limits red zone?
Thank you for bringing that up. Unfortunately, I need to start wrapping up the show because we've been talking about so many great issues. Joe, I'll start with you and we'll kind of head on down. King County still wrestling with this issue. Seattle clearly moving ahead here. What's the main thing you want our elected leaders, the public, to know about safe consumption sites moving forward?
I think the most important thing is that we design them to serve the communities that they're in and make them connect well to the systems that can provide services, whether that's addiction treatment, mental health, medical care, housing. And those, I think, paying attention to those connections is really the most important thing.
I need the 20-second version if you can, Gretchen.
There are so many people for injection sites and they're making it all about politics. It's not. It is about human life, and we believe meet them where they are. That's a great philosophy, but what then? And we believe stop them where they are. Treatment will save lives. Continuing injection won't.
Thank you very much for that. Chloe, final thoughts here.
I'll just add that I know that our opioid epidemic is a disease of isolation. People die alone. And I believe that what's going to save lives is bringing them inside and bringing them connection.
Thank you very much for that. Rob, I know a lot happening in 2018 here. The spending plan maybe for that $1.3 million. Does the city go this alone? Do you get support from King County? Briefly, what's going on next?
You know, we have a report due back to the City Council in the end of February about both the potential siting as well as the joint components, both operations and capital that's necessary to stand up a facility. The city's prohibited from spending the money until we have that report back. We have a lot of work that we need to do with providers, with the county, with our own internal departments before we stand up something, but we are making progress, and I think that that progress is important.
Okay, 1 or 2 facilities, do we know that yet?
You know, we think that the resources that we've put in at that $1.3 million level is enough to support 1 facility. I don't think that it's enough to support 2, but I do believe that if this facility is successful, we'll be getting requests from other partners to open up additional facilities, whether that's in the city or in the county, to be determined.
All right, thank you all for this great discussion. We will be right back.
Throwing him in jail for years at a time is not solving the problem.
I'm concerned about the chance of increased crime.
I think it's just another way of trying to cover up the real problem.
We'd like to know what you think. Send us an email at contact@seattlechannel.org or find us on Facebook and Twitter and give us your feedback.
Before we close today, it's time for our weekly CIO poll. Do you support a safe injection site in Seattle? Yes, no, or are you undecided? We want to know what you think. Cast your vote and send us your comments at our website, seattlechanel.org/cityinsideout. While you're there, you can watch our programs online anytime. Coming up next time, the future of Key Arena. The Seattle City Council is poised to approve a $600 million agreement with Oakview Group next week. Is it a good deal for taxpayers and fans? We'll give you a front row seat to the details next time on City Inside Out. I hope you join us.